since the start of this new administration, the American public health infrastructure has been dismantled from the top down, from the CDC Healthy Tribes program, scientists being let go, and again, like you said, vaccines. And I guess this question's for Abigail first. For listeners who haven't heard about the CDC Healthy Tribes program, can you explain what happened there and how this impacts Native people?
And so the Healthy Tribes program encompassed a multitude of different grants who are all focused on chronic disease prevention. So things like diabetes, heart disease, obesity, and we were doing it through our own cultural ways. And so Healthy Tribes as a program established in the CDC is again the upholding of treaty and trust responsibility. We have a prepaid benefit to ensure the health and well-being of our people. And as a result of the harm of colonialism, we know that many of our people suffer from health disparities like diabetes. So putting that program in the CDC was the federal government upholding treaty and trust responsibility. What has happened is they have laid off a majority of the staff. They're talking about reorganizing and shifting. For my programs right now, and I've talked to people across the country, we don't have the same resources that we had to coordinate with the CDC to ensure that we were fulfilling all of our financial obligations, that we could make shifts and adjustments to our programs. For example, we just hosted a large number of, it was a little over 20 folks from across urban Indian health programs, where we trained them on how to implement traditional foods into their programs and into their clinics. Those are essential to our people's healing. It's all about taking care of our people and the community. And so while it may be dissolving across the nation right now, we are going to fight to uphold it. We will not let it be done in silence, and we won't let them do it, honestly. But the thing that we have to hold on to is we have it in our own communities and we maintain it. And so we need to hold on to that cultural value of taking care of our people. And we saw it during COVID-19. American Indians and Alaska Natives, we did it best, and we will continue to do so, but we will fight for treaty and trust obligations to be upheld, and restoring the Healthy Tribes program at the CDC is one of my number one priorities.
So whether offices or programs in the CDC have been affected by this administration?
Well, for one, they were supposed to have a tribal consultation meeting in the winter. That has never happened. The other thing I do know is that there were tribal liaisons at each center. Those have been eliminated. Many of the offices had a lot of programs that were going on in Indian country, like the Injury Center, which is the second leading cause of death in our communities. That program has been eliminated.